Let's just take a couple of minutes talking about inversion tables, inversion therapy, if you will. Why do we do it? Why is it here? Well, if you think about gravity always compressing down on our spine, whether we're sitting or standing for a long period of time, these discs, kind of like jelly donuts, are getting squished in between these vices of vertebrae. And we want to try and create a kind of a pumping mechanism to create more circulation, more hydration, make them happy and healthy. So that's where the inversion table comes into play. It dates back to the time of Hippocrates, the father of modern medicine. And he used to lash his patients' ankles to a ladder and have his assistants flip them upside down. But we're not going to do that. Instead, we're going to do it at what's known as oscillating inversion. Most people, when they jump on this, they figure if I just go upside down, it's all going to be good. But that's pretty extreme. That's a high progression. Let's just take it slowly. When you lay down on the inversion table, you want to be at such the adjustment in your leg length where you can lay here and be level. And then all we're going to do is take our arms and slightly reach overhead and then back to our feet. And what you'll see is like that old-fashioned, that science tube, or the tube you had in science class, where there's colored water with oil, and you tilted it in one direction and it created a wave. And then you tilted it back and it created another wave. And what we're doing with this oscillating inversion is we're using gravity to help us open up the body and then relax, and then open up the body and then relax. Kind of like CPR for not only your spine, but for basically all the joints in your body. So as long as you don't have any contraindications where you shouldn't be upside down or slightly inverted, you might want to give this a try.